I have cardiovascular disease, so I have blocked arteries or arteriosclerosis, and I was diagnosed in 1998 and underwent bypass surgery then and had 5 arterial bypass grafts. What happened after the surgery I had was that one of the grafts collapsed and one of the arteries withered, so I was getting reduced blood flow to my heart, so I started to experience chest pain, angina. Basically I was medicated, did some tests. The doctors felt I was getting enough blood flow to my heart. Didn't warrant any intervention with either stents or angioplasty, so I was on medication. That has gone on for a number of years until recently, when I experienced some different pain, ended up being hospitalised. Again, tests showed my heart was okay. Didn't want to do intervention again, but I just felt that I was sort of waiting around, waiting for a heart attack to occur, so I was looking for some alternatives. There was actually some research being done in Australia at St Vincent's Hospital in Sydney, and there was a press article in our local paper about 3 years ago. So I was intrigued by that, and this was using stem cells to correct cardiovascular disease, and so I rang the doctors responsible for that research, and indeed the clinical trials are underway. They told me that they have good data, but obviously it was going to take some years before, if the research was effective, or the trials were effective, for that to come onto the open market, would be available to patients like myself. So I decided to look at what had been done around the world with stem cell therapy. Originally I was interested in the German treatment, but that was a fairly invasive procedure. Involved a catheter up through the groin into the heart, injection of stem cells into the heart muscle, and then I discovered, basically just through doing the research, that this a non-invasive procedure was available in Mexico. Yeah, well, not so much. The cost was very similar to Europe, but actually the travel was more convenient. Going across the Pacific involved 13 or 14 hours. To Germany it was about 24 hours. So the travel was less. You're in the USA, and then a short trip down to Tijuana, just across the Mexican border. So, and principally because the treatment was less invasive, I opted for that way. It was no problem. We arrived in LA from Brisbane. Drove down to San Diego, was met by Elias, yourself, and it was very, very smooth. We stayed in a very nice hotel in Tijuana, which was very close to the clinic, and it was very smooth. The experience was better than I had actually expected. I think, without being disrespectful to Mexico and medical treatment, that doesn't have a reputation worldwide for medical breakthroughs, so I was very pleasantly surprised. The doctors were terrific, and they really knew what they were talking about. The procedure itself was pretty simple. There was no pain. There was a little bit of discomfort when they extracted the bone marrow, but that was very simple, all done in probably an hour and a half, 2 hours. And the procedure obviously was extraction of the bone marrow and then injection into your veins, in your bloodstream. It's probably a couple of hours now since the procedure, and I feel fine. I feel excellent.